Hello students, welcome to today's class. So today we will be learning about the muscles of the back and the scapular region. In this video, I will be showing you the dissection of real cadaver and the attachments of the different superficial muscles of the back and the scapular region. Now students, before moving to the dissection video, we should learn about the different surface landmarks first. So let's have a look at this image. Here you can see the dorsal aspect of a person standing. So this point where the maximum protuberance is present on the posterior aspect of the skull is known as the external occipital protuberance. From this external occipital protuberance, two lines they run transversely. These are known as the superior nuchal lines. Now, students, in a living person, if you palpate this region and move down, you will find a spinous process. That is the spinous process of the second vertebra. This is the spinous process of the second vertebra. And as you move your hand along the concavity of the back of the neck, you will reach a point where you will find a large prominent spine. So this prominent spine is of the seventh cervical vertebra. This seventh cervical vertebra, because of this large spinous process, is also known as the vertebrae prominens. Okay, students. Now, moving on to the next important surface landmark. Now, on the posterior aspect of your thorax, you will find a ridge, a bony ridge. That is the spine of the scapula. The spine of the scapula, it is at the level of the third thoracic vertebra. So, it is at the level T3. That is the spine of scapula. Now, as we move downwards, we can palpate the inferior angle of the scapula. This inferior angle of the scapula, it lies at the level T7. So, at the thoracic vertebra level 7, we have the inferior angle of scapula. Apart from that, another important surface landmark is the iliac crest, which we can palpate as we move further down. So students, these are few important surface landmarks that we should know. Apart from that, I want all of you to know about this prominent structure. So when you flex your neck, this structure which becomes prominent is known as the ligamentum nuchae. This ligamentum nuchae or the nuchal ligament, it extends from the external occipital protuberance to the sixth cervical vertebra. Alright, so to the C6 level it is extending. So here again you can see the prominent spinous process. This belongs to the C7 or the vertebrae prominens. Alright, now students, in the dissection video, after removal of the skin, the superficial fascia, we come to the layer where there is the presence of this large superficial muscles of the back. You can see this muscle having an extensive origin. The extensive origin I am showing in blue color. So here you can see the superior nuchal lines, the external occipital protuberance, the nuchal ligament or the ligamentum nuchae, and along the spinous process from C7 to the T12. So here is the external occipital protuberance. Here you have the termination of the ligamentum nuchae. These are the superior nuchal lines. And from here you have the spinous process of T7 to the T12. The spinous process of C7 to T12. Now students, you can see it is taking insertion along the spinous process of the scapula, along the acromioclavicular joint, and along the inner border of the lateral end of the clavicle. So it has a large insertion along the upper lip of the scapula, along the inner margin of the acromioclavicular joint, and also along the inner margin of the lateral end of the clavicle. The second muscle I want all of you to see is this huge muscle of the back. This is known as the latissimus dorsi. It is also having an extensive origin right from the T7 vertebra or the thoracic vertebra 7, and it has origin along the spinous process all the way down to the sacral spines, and also from the thoracolumbar fascia. The thoracolumbar fascia, and you can see the muscle fibers moving in different direction, twisting around and taking insertion onto the humerus. So where do they insert on the humerus? Yes, they insert onto the floor of the bicipital groove. Apart from that, on this side you can see the muscles which are attached from the axial skeleton to the appendicular skeleton, and they lie in an intermediate layer. So the trapezius, latissimus dorsi, they were the superficial layer muscles. Whereas if we remove them, we can see the next layer of muscle, that is the intermediate layer. So here the first muscle is the levator scapulae. It generally arises from the transverse processes of the cervical vertebrae. Then we have the two rhomboids. Based on their shape, they have been named as the rhomboids. So here you can see the two rhomboids. The upper one is the rhomboid minor. You can see it is attaching above the root of the spine of the scapula. So here you can see this is the spine of the scapula. This is the root of the spine. Above it we have the attachment of rhomboid minor. Alright, so then we have the attachment of the rhomboid major, which is below the root of the scapula. So here is the root of the spine of scapula. Below that you can see the rhomboid major muscle. So students, these are the different muscles which we will be now seeing in the original dissected specimen.
Okay, so as I reflect the skin, you can see the superficial fascia has also been removed. And after removing the deep fascia, we can see this triangular muscle. Actually, it is one half of the muscle, the other half is present on the other side. So if we take this muscle as a whole, it has this type of shape. The upper origin I told you from the superior nuchal lines, external occipital protuberance, the nuchal ligament, then from the vertebra prominence to the T12, the spine of the T12 vertebra. All right. So now I have cut this muscle along its origin from the C7 to the T12. From the C7 and T12 I have cut, and now I am reflecting this muscle trapezius. So as I reflect this muscle trapezius, you can see where its fibers are inserting. This bony prominence, you are seeing this is the spine of the scapula. This region is this triangular region. This is the root of the spine. So this is the spine. This is the root of the spine. Above this root of the spine, you have the insertion of a muscle which elevates the scapula. That is the levator scapula. So, students, this muscle which you are seeing, this is the levator scapula. Now, at the root of the spine, you can see another muscle taking insertion. So, this muscle is the rhomboid minor. Then below the root of the spine, along the medial border, of the scapula, you can see this large muscle, the rhomboid major. So this is the rhomboid major, the rhomboid minor, and the levator scapulae. So these muscles you can see they are coming from the axial skeleton and attaching to the appendicular skeleton. Few books they call them as the superficial muscles, few books write them as the intermediate muscles. So if I cut along this insertion of the trapezius, all right. So see, I am removing the trapezius along its insertion. You can see it is attached to the upper lip of the spine of this scapula. Actually, students, if I tell you, I have already told you about the origin of the trapezius. Insertion, what happens? The upper fibers, they are going and they insert onto the inner border of the lateral end of the clavicle. The middle fibers, the fibers you can see here, the middle fiber, they are running transversely. The upper fibers, they were running in a downward direction. Whereas the lower fibers, you can see direction of fibers, it is running in a upward direction.
Upward.
So upper fibers running downwards, middle fibers running transverse direction, whereas the lower fibers they are running in a upward direction. Now these fibers, the upper fibers, they are inserting onto the posterior border of the lateral end of the clavicle. These transverse fibers, they are inserting onto the medial surface of the acromioclavicular joint. ठीक है, here you have the acromioclavicular joint. So here, this is the acromioclavicular joint. So medial surface of the acromioclavicular joint, you can see these fibers inserting. Then these lower fibers, they are inserting onto the upper lip of this scapula. Upper lip of the scapula. So this is how this large trapezoid muscle is originating and inserting. As I remove this, you can see above the scapula you have this muscle known as the supraspinatus. This supraspinatus is filling the supraspinous fossa. Below you have the infraspinatus. This muscle is the infraspinatus. Now students, what will you identify this muscle as? So this muscle is the posterior fibers of the deltoid. You can see this is the lower lip. This is the lower lip of the spine of the scapula. Here you can see this is the spine and you can see the lower lip. So along the lower lip of the spine of the scapula, you have the attachment of the posterior fibers of the deltoid. Similarly, here you have the acromioclavicular joint. From the lateral aspect of the acromioclavicular joint, you have the middle fibers of the deltoid. These middle fibers are forming the major contour of our shoulder joint. You have the anterior fibers. Where they are coming from? They are coming from the anterior border of the lateral end of the clavicle. Apart from that, I showed you these muscles, the rhomboid major, rhomboid minor, levator, scapulae. All right. Okay. Now, students, this is the supraspinatus, infraspinatus. Here you have the deltoid. This is the spine of the scapula, upper lip, lower lip. Along the upper lip, you have the insertion of the trapezius. Along the lower lip, you have the origin of the deltoid. Where the deltoid is going to insert? Deltoid tuberosity present on the lateral aspect of the humerus. Coming to this region, here you have the further deep muscles. Here the fascia. Here the fascia has not been removed. Below this, you have the group of muscles known as the erector spinae muscles. All right, so we'll see them afterwards. But what is important for you now to identify, which is the triangle of auscultation. So for that, we have to reflect the skin here. So this skin I have reflected now. So students, you can see another broad muscle in this region, this muscle. You can see? This entire muscle is a single muscle having a large origin. This entire muscle, it is the latissimus dorsi. So students, if you see, if I place it properly, its origin is much higher. So this is actually how the muscles are arranged. This is the trapezius, which inserts onto the 12th spine of the 12th thoracic vertebra. And here you have the latissimus dorsi, which is originating from the T7 spine of the 7th thoracic vertebra. It is then taking origin all along this spine, and also you can see this condensed fascia. This region, this fascia, it is known as the thoracolumbar fascia. This thoracolumbar fascia, you can identify it is looking shiny, aponeurotic, and it is also a modification of the deep fascia. So from the thoracolumbar fascia, then again you can find another bony ridge, which is known as the iliac crest. So along the iliac crest also you can see the fibers originating. And where they are going to insert? So students, if you see, they are moving upward and anterior and laterally. Upwards, anterolaterally. They are moving. Here you can see at the inferior angle of the scapula. Few fibers are originating and they are also joining this muscle. Now they are together blending and it twists around and goes and inserts where? Just show here how the fibers are twisting around now. It is going and twisting around and inserting onto the floor of the bicipital groove. At the floor of the bicipital groove. So students, this is the last muscle, which is the latissimus dorsi. Now if I again place back the trapezius. So can you tell me which is the triangle of auscultation? So in front of your eyes you can see this. This region is the triangle of auscultation. So this region is known as the triangle of auscultation. You can see this region is devoid of any superficial muscles. You have only the intercostal muscles. So when a patient comes, if you place your stethoscope at this site, you can hear the lung sound.